Our blood vessels are important for transporting oxygen, carbon dioxide, nutrients, hormones, and waste products to and from body tissues. The heart is the organ that pumps and propels the blood through our blood vessels, and together the heart and blood vessels form this closed-loop system for the exchange of these different molecules. If we were to lay our blood vessels from end to end, this would be about 60,000 miles of distance. As a reminder, we have two different systems. We have the systemic circulation and the pulmonary circulation, where the systemic circulation of the cardiovascular system consists of the blood vessels that extend to all body regions. The pulmonary circulation consists of the vessels that take the blood to and from the lungs and for gas exchange. For both systems, there's three different classes of blood vessels, and they are arteries, capillaries, and veins. The systemic circulation, we have the ventricles of the heart. When they contract, the arteries then convey blood away from the heart to the body. The arteries then branch into smaller and smaller vessels until they feed into the capillaries, and this is where gas and nutrient exchange occurs due to the very thin layer of epithelium, a thin layer of the simple squamous epithelium. Then, from the capillaries, the veins return blood to the heart. Arteries tend to become smaller as they branch and extend farther away from the heart, whereas veins become larger as they merge and come close together to the heart. Often we have arteries traveling with corresponding veins, and these are called companion vessels because they supply the same body region and tend to lie next to one another. Both blood vessels of the arteries and the veins are composed of three layers called tunics. The tunics surround the lumen, which is the inside space where the blood actually flows through. The innermost layer of the blood vessel wall is the tunica intima, and this is made of a layer of simple squamous epithelium that lines the blood vessel lumen. The tunica media is the middle layer of the vessel wall. It is composed in a circular arrangement of smooth muscle cells, and within the tunica media, this is where we get vasoconstriction and vasodilation. Vasoconstriction is due to innervation within the sympathetic nervous system that causes the smooth muscles to contract, thus narrowing the flow of blood. When we have vasodilation, there is widening of the blood vessels, and these smooth fibers then relax, allowing for more blood flow. Lastly, the tunica externa is the outermost layer of the blood vessel wall. The tunica externa helps to anchor the vessels to other structures. Now, very large blood vessels require their own blood supply to the tunica externa in the form of a network of small arteries called vasa vasorum. For instance, the aorta, which is a very large artery, has its own vasa vasora because of the demand for blood supply to that large vessel. When comparing arteries and veins in structure and looking under the microscope, arteries in general tend to maintain their shape in tissues due to having a thicker tunica media layer, which again is a layer of the smooth muscle and is the middle layer. And also, their fibers tend to be more elastic within the walls of the arteries as compared to veins. When veins are not filled with blood, the walls of the neighboring veins sometimes will collapse due to lack of blood and lack of elasticity and strength due to the lack of the tunica media in size. Due to the forces of gravity, blood pressure in the veins usually are too low to overcome its forces. Thus, to prevent blood from pooling into the limbs, especially within the lower limbs, and to assist moving back to the heart of the blood, most veins contain valves that are usually found within the tunica intima and are strengthened by elastic and collagen fibers. This helps for blood flowing superiorly into the limbs and creating one-way valves to prevent backflow back into those inferior limbs. In addition to valves, deep veins pass between the skeletal muscle groups. Thus, when we have contraction of the skeletal muscle, these veins are squeezed to help pump the blood towards the heart, thus creating the skeletal muscle pump. When the muscles are more active, such as when somebody is walking or running, the blood is pumped more quickly and efficiently to the heart. On the contrary, individuals that tend to be more inactive have an increased chance of having blood pooling in the leg veins. For pulmonary circulation, here we have deoxygenated blood, and we'll begin in the right ventricle. The blood flows from the right ventricle into the pulmonary trunk. From the pulmonary trunk, the deoxygenated blood will flow to both the right and left side of the pulmonary arteries. The pulmonary arteries will stem into the lobar arteries, which are found within the lungs, and then into the smaller pulmonary capillaries. At the pulmonary capillaries found within the lungs, this is where the exchange of gases occurs, and we go from deoxygenated blood to now oxygenated blood. This new oxygenated blood goes from the pulmonary capillaries to the venules, and then from the venules into the pulmonary veins, which are found on both sides because we have a left and right lung. And then finally, the oxygenated blood from the pulmonary veins dump into the left atrium. Oxygenated blood is pumped out of the left ventricle of the heart and enters the ascending aorta. The ascending aorta curves towards the left side of the body and becomes the aortic arch. The three main arterial branches that stem off of the aortic arch are 1. The brachiocephalic trunk, which splits into the right common carotid artery, which supplies the blood to the right side of the head and neck, and the right subclavian artery, which supplies blood to the right upper limbs and some thoracic structures. The second part that stems off of the aortic arch is the left common carotid artery. This supplies the left side of the head and neck, and then lastly, the left subclavian artery supplies the left upper limb and some of the thoracic structures. The aortic arch curves and projects inferiorly as the descending thoracic aorta that extends several branches to supply the thoracic wall. When this artery extends inferiorly through the aortic opening of the diaphragm, it is then renamed as the descending abdominal aorta. The left and right common carotid arteries supply most of the blood to the head and neck. They travel parallel immediately lateral to the side of the trachea. At the superior border of the thyroid cartilage, each artery divides into an external carotid artery that supplies structures external to the skull, and an internal carotid artery that supplies internal structures of the skull. The branches from the subclavian artery include the vertebral arteries, which travel through the transverse foramina of the cervical vertebrae before entering the skull through the foramen magnum. Also, there becomes the cerebral arterial circle, or the circle of Willis, which is important for the arteries surrounding the sella turcica, which houses the pituitary gland. This arterial circle helps to equalize blood pressure in the brain and can provide collateral channels if one blood vessel becomes blocked. From each subclavian artery, there is a left and right internal thoracic artery that emerges to supply the mammary glands and the anterior thoracic wall. The descending thoracic aorta is responsible for supplying blood throughout the thoracic cavity and superior to the diaphragm. For the blood flow through the upper limbs, we begin at the subclavian artery, which supplies blood to each upper limb. The left subclavian artery emerges directly from the aortic arch, whereas the right subclavian artery is a division from the brachiocephalic trunk. After the subclavian artery passes over the lateral border of the first rib, it's renamed the axillary artery. The axillary artery extends many branches to the shoulder and the thoracic region. When the axillary artery passes the inferior border of the teres major muscle, it is renamed the brachial artery. The brachial artery travels alongside the humerus, and where it is at the cubital fossa, which is the anterior position of the elbow, the brachial artery divides into the ulnar artery and the radial artery. The radial artery runs alongside the radius, and the ulnar artery runs alongside the ulna. Both of these arteries supply the forearm and the wrist, where then they form the arch of the palm, or the palmar arch, where the blood then from the palmar arch goes to the digits of the hand. Inferior to the diaphragm is the abdominal aorta, which supplies blood for the gastrointestinal tract. Directly inferior to the diaphragm is the celiac trunk. This helps to supply blood for the stomach, part of the duodenum of the small intestine, the liver, part of the pancreas, and of the spleen. Inferior and lateral are the renal arteries, which are left and right side, to supply blood for each kidney. Inferior to those are the gonadal arteries, which are important for supplying blood for each gonad, such as the testes for males and ovaries for females. And inferiorly, we have the common iliac arteries, which branch into a left and right side, where they supply blood for the pelvis and the perineum. The main arterial supply for the lower limb is the external iliac artery, which is a branch of the common iliac artery. The external iliac artery travels inferior to the groin, where it is renamed the femoral artery. The femoral artery supplies the hip joint and many of the thigh muscles. The femoral artery passes through an opening in the adductor magnus muscle and then enters on the posterior side, where the vessel is then renamed the popliteal artery. The popliteal artery supplies the knee joint and the muscles in the region. The popliteal artery divides into an anterior tibial artery that supplies the anterior compartment of the leg, and a posterior tibial artery that supplies the posterior compartment of the leg. The anterior tibial artery crosses over the anterior surface of the ankle, where it is renamed the dorsalis pedis artery. The dorsalis pedis artery and a branch of the lateral artery form the plantar arch, where from the plantar arch we have blood vessels that supply the digits of the toes. Arteries are typically used in order to determine a pulse or the heartbeat of an individual, as when one presses or palpates an artery, this presses the artery against the bone, where that pulsation can easily be palpated for an individual. So common areas of where to measure the pulse are the temporal artery, the facial artery, the common carotid artery, which are one of the most common, as well as the brachial artery and the radial artery. Some more or less common places are the femoral, popliteal, posterior tibial artery, and the dorsalis pedis artery. The superior vena cava drains blood directly into the right atrium. From the superior vena cava is the branch of the brachiocephalic vein. The brachiocephalic veins also have extensions of, firstly, the internal jugular veins. The internal jugular veins drain blood from the brain, the superficial face, and the neck. From the brachiocephalic vein, we go on further and away from the heart, is the subclavian veins, where the subclavian vein has a branching of the external jugular vein. The external jugular veins collect blood from the exterior cranium and the deep face. Also are the vertebral veins, which extend from the transverse foramina of the cervical vertebrae and drain into the brachiocephalic veins. Thus, these will be more posterior than the internal jugular vein and the external jugular vein. Most of the venous blood of the cranium drains through several large veins, which are collectively known as the dural venous sinuses. There are no valves in the dural venous sinus system, and this is interesting because potentially blood can flow in more than just one direction as it does in the rest of the body due to the valves. The superior vena cava is a short but wide vessel that carries deoxygenated blood from the upper extremities into the right atrium. Running alongside the superior vena cava is the azygos vein, which is only found on the right side of the thorax. Here this drains straight into the superior vena cava and it runs along only the right side of the thorax vertebral column and collects blood on the posterior wall of both the thorax and the abdomen. This azygos vein is important because it connects a system of the superior vena cava with the inferior vena cava for an alternate path into the right atrium if anything is to be blocked or decreased in size within the vena cavas. The vessels that make up the deep veins of the body begins with the subclavian vein, which originates at the outer border of the first rib. It runs under the clavicle and connects to the jugular veins, where this empties blood from the upper extremities to the heart. From the subclavian vein branches the axillary vein. The axillary vein is on the medial side of the axillary artery, and it begins at the border of the first rib and drains into the subclavian vein. It transports blood from the thorax, armpit, and upper limb. From the axillary vein, the brachial vein emerges, where this is formed from the inferior border of the teres major muscle to the medial vein. The blood from the upper arm muscles, such as the biceps and triceps, empty from there. From the brachial vein, we have the radial veins and the ulnar veins. The radial veins run alongside the radius and alongside the radial arteries, and they drain blood from the forearm and the hand. The ulnar vein runs alongside the ulna and alongside the ulnar arteries, where it drains the blood of the forearm. From the ulnar vein, we have the palmar venous arches, which is a continuous loop that drains the blood from the fingers and digits. The cephalic vein is a superficial vein that is on the lateral side of the arm and extends from the hand to the shoulder. At the level of the shoulder, it will empty into the axillary vein. The basilic vein, it runs alongside the back of the forearm on the ulnar side, and then it curves to the surface below the elbow on the medial side, and then it reaches the middle of the upper arm and extends and enters into the brachial vein. The medial cubital vein is the connection between the basilic and the cephalic veins, and this is where it runs from medial to lateral in the anatomical position, and is where we get our venipuncture or our typical standard blood draws from. The inferior vena cava is the largest vein in the body, and this carries deoxygenated blood into the right atrium. From the inferior vena cava, we have several different branches, such as the renal veins, which carry deoxygenated blood from the kidneys, the gonadal veins, which will be inferior to the renal veins, and they empty blood from the gonads, and then the hepatic portal veins, which will be important for collecting deoxygenated blood that is nutrient-rich from the gastrointestinal tract. A note about the drainage of the veins, where the gonadal vein directly drains into the left renal vein. And the left renal vein, the right venal vein, and the right gonadal vein all directly merge from the inferior vena cava. The hepatic portal system is a venous network that drains the gastrointestinal tract and shunts the blood to the liver for absorption and processing of transported materials. Following nutrient absorption, the blood exits the liver through the hepatic veins that merge with the inferior vena cava. This is needed because the gastrointestinal tract absorbs digested nutrients, and these nutrients must be absorbed and processed in the liver. The liver is also responsible for detoxifying harmful agents that have been absorbed by the gastrointestinal vessels. The hepatic portal system also receives products of erythrocyte destruction from the spleen, and the liver can recycle some of these components, such as iron, to be recycled to create new erythrocytes. The common iliac vein arises from the inferior vena cava and transports blood from the legs and pelvis back to the heart. From the common iliac vein, it branches into the internal iliac veins and the external iliac veins. The internal iliac veins are deep in the pelvic region, where blood is carried away from the organs of the reproductive, the urinary, and the digestive systems. The external iliac veins return deoxygenated blood from the legs back to the heart, and this is found just behind the pelvis in the lowest region of the abdomen. From the external iliac veins, we have the branching into the femoral veins, which receive deoxygenated blood from several branches in the lower limb. From the femoral vein is the great saphenous vein, which is the longest vein in the body, and it is a superficial vein of the medial leg and the thigh. It extends from the top of the foot to the upper thigh and groin. It returns blood from the superficial tissues of the leg. The popliteal vein carries blood from the knee joint and calf and thigh and is found on the back side of the knee and is an extension of the femoral vein. The popliteal vein splits into an anterior tibial vein and a posterior tibial vein. The anterior tibial vein is on the front compartment of the lower leg, and it goes from the upper ankle joint to just above the knee. From the anterior tibial vein, we have the dorsalis pedis veins, and these run along the top side of the foot and carries blood from the phalanges of the foot. From the popliteal vein, the second compartment is the posterior tibial vein, and this is a branching from the popliteal vein and is found beneath the calf on the posterior side of the body. From the posterior tibial vein is the plantar venous arch, and from there that will connect blood from the phalanges and digits from the foot. Arteriosclerosis is the general term that's used for hardening of the arteries. Atherosclerosis is a progressive disease of the elastic and muscular arteries. This is usually characterized by the presence of an atheroma, or a plaque, which leads to thickening of the tunica intima and thus narrows the lumen for those arteries and decreasing the amount of blood that flows. Angina pectoris is not a disease but rather a symptom of coronary artery disease that is caused by narrowing or blockage of coronary arteries. Typically, it results from strenuous activity when the workload demands of the heart exceed the ability of the narrowed coronary vessels to supply the blood. The pain from the angina is typically referred to as the pain that runs down the chest or down the left arm, where the T1 dermatome is located. After a short time, the pain might stop and blood may revert to normal. Myocardial infarction, or MI, is commonly known as a heart attack and can be potentially fatal due to how much blockage there is of the coronary artery. The region of the myocardium becomes deprived of oxygen, and this may cause some of the tissue to die and become black, called necrosis. The symptoms of MI are different for men and for women, where most times men experience a myocardial infarction to be sudden and excruciating painful, may have chest pains and sweating. Women, however, have less chest pain, and they might be described as an aching, tightness, or pressure rather than pain in some of the back and high chest regions. Women often experience shortness of breath because they don't exhibit the traditional or classic symptoms that doctors expect and are common with men. And so it's likely for a female to be sent home from the ER because of improper diagnosis of heartburn or anxiety rather than myocardial infarction. If an artery is blocked in just one or a few areas, depending on the area, a treatment called angioplasty is used. This is where a balloon-tip catheter is inserted into an artery and is positioned at the site where the lumen is narrowed. The balloon is then inflated, and this forcefully expands that narrowed blood vessel. To ensure that the area remains open, a stent can be placed at that site, and the stent is a piece of wire mesh that springs open to keep the vessel lumen open. And this becomes a permanent structure of that vessel. For occluded coronary arteries, a very invasive treatment is used known as coronary bypass surgery. Usually the great saphenous vein is used because it is very superficial and long, or sometimes an artery, such as something like the internal thoracic artery, is detached from its original location and then is grafted from the aorta to the coronary artery system. And thus, this bypasses the area of the narrowing due to atherosclerosis. Varicose veins are dilated veins where the valves have become non-functional, and this causes blood to pool in one area and the vein to swell and bulge. Varicose veins are most common in the superficial veins of the lower limbs, where they tend to have the hardest time to combat gravity and the valves become dysfunctional. Causes include genetics, aging, and excess stress, such as standing for long periods of time, obesity, and with pregnancy. Varicose veins can become inflamed and painful, and sometimes may even have fluid leaking from them into the surrounding tissues. Another common type of varicose vein are hemorrhoids, which are found within the anal and the rectal region of the body, and this is due to increased intra-abdominal pressure, such as when a person strains to have a bowel movement or is in labor during childbirth. An aneurysm is a localized, abnormal dilation of a blood vessel. Although aneurysms form in any type of vessels, usually they're most common in arteries, especially the aorta, because of the higher blood pressure on the arterial side of the circulation. After being initiated by weakness in the wall of the vessel, an aneurysm tends to increase in size over a period of weeks or months until it ruptures.